The oversized scrubs hung 2 sizes too loose, and that was intentional. Ashley Cooper had learned the mathematics of invisibility: fabric that didn't cling, hair pulled tight enough to hurt, eyes that never quite met anyone's gaze during morning rounds at Oak Creek Memorial. The hospital smelled like antiseptic and burnt coffee, that particular combination that only exists in places where people come to die or be saved, sometimes both on the same shift. Fluorescent lights buzzed overhead like trapped insects, casting everything in a sickly blue-white that made her skin look cadaverous. She preferred it that way. Invisible was safer. The ICU ward stretched out before her, 8 beds, 6 occupied, 1 vent alarm pinging its lonely rhythm down the corridor. Ashley moved between them like water finding the lowest point, her crocs silent on linoleum worn thin by a million footsteps before hers. She'd been at Oak Creek for 14 months, 3 weeks, and 5 days. Not that she was counting. Not that anyone had noticed her long enough to ask her name beyond the nameplate she'd fabricated, A. Cooper. Just A. No first name on the scrubs. Harder to remember. Harder to trace. Room 304 was at the end of the corridor, and that's where she spent most of her attention. The man in that bed, the one the charts called Marine General, no name, no family contact beyond a note marked classified, had shrapnel scars that mapped a geography of violence across his chest. Traumatic brain injury. Severe retrograde amnesia. Moderate cognitive decline. The medical language tried to package what was really just a man whose mind had been buried under concrete and mortar fire and whatever else the Marine Corps wouldn't talk about. His eyes were the color of a winter sky over the Atlantic, and they searched constantly for something just out of reach, like a man looking for his own name in a dictionary written in another language. She adjusted his full line, a 20-gauge peripheral catheter in the left antecubital fossa, clean insertion, no infiltration, and noticed the tattoo on his forearm again. A. Cooper. Dark green ink, military precise. Her name. Except it wasn't her first name at all. It was her call sign. Reaper. That's what the unit called her. That's what the man in the bed had called her too, back in Ramadi when the world was different and she was someone official instead of someone erased. She didn't let her hand shake when she checked his pulse. Steady. 72 beats per minute. Good. His eyes tracked her for a moment, that searching, empty gaze, and then slid away. No recognition. No spark. Just a stranger in scrubs taking his vitals. That was the worst part, and she wouldn't admit it to anyone, especially not to herself in the dark hours when she sat in her apartment at 2 in the morning, hand pressed against the scar on her shoulder where the shrapnel had gone in, the one that should have killed her, the one that almost did, the one that got him instead. He'd thrown her down. Covered her with his body. The debris found him instead. The heart monitor beeped its steady rhythm. Sinus rhythm. Normal. She wrote down the numbers, BP 118/76, O2 sat 98%, temperature 37.1 Celsius, and turned to leave the room when she heard the footsteps. Dr. Richard Hargrove arrived for afternoon rounds the way he arrived for everything, with the presence of someone who had never been told no. His suit cost more than Ashley made in a month, charcoal wool from somewhere that specialized in dressing men who'd inherited their confidence the way other people inherited eye color. His watch caught the fluorescent light and threw it back like a challenge. Rolex. $50,000 minimum. She'd learned to notice these things in another life, when noticing details meant staying alive. Hargrove was tall in the way that only men who'd never questioned their own authority could be tall. It wasn't height, it was presence, it was the way the air pressure seemed to change when he entered a room. He was reviewing charts at the nurse's station, his pen moving with decisive certainty, when Ashley approached with the morning's documentation. Other nurses deferred to him, called him Dr. Hargrove with a particular inflection that suggested they were speaking to a god who'd forgotten to mention he was a god. She called him nothing at all. She waited until he'd finished reviewing the morning's admissions, until his expensive pen had moved through 3 different patient files with the confidence of someone who'd never been questioned. Then she pointed quietly to the billing code on the Marine General Surgical Supply Requisition. Chart number 70 for 38 lay supply order dated 3 days ago. The code didn't match the procedure documented, there were phantom expenses logged, extra supplies that hadn't been used, charges that made no sense to anyone who actually understood medicine instead of just profiting from it. "I think there might be a clerical error, doctor," she said. Her voice was small, soft, the voice she'd practiced for 14 months, 3 weeks, and 5 days. The voice of someone who was asking permission to breathe. "The billing code on this order doesn't match the documented procedure. The supplies listed, they're not standard for post-op care." His pen stopped moving. He looked up slowly, the way a predator might look up from a meal if someone had dared to suggest it wasn't as good as he thought it was. His eyes were grey, and they were sharp, and they were the eyes of a man who'd just understood something important. She'd made herself visible. And visibility, she realized in that moment, had a weight to it that she'd underestimated. "Is that so?" Hargrove's voice was smooth, practiced, the voice of someone who'd been smoothing over problems his entire professional life. He set down his pen with deliberate precision. "And you're concerned about our billing practices now, Ashley?" He'd said her name. That was new. That was wrong. That meant he'd looked at her nameplate. That meant he'd registered her as something more than the background noise of the hospital. "Just an observation, doctor," she said. Same soft voice. Same deferred posture. But something had shifted in the air between them, like pressure dropping before a storm. Hargrove smiled, and it wasn't a kind smile. It was the smile of someone who'd just solved a problem he didn't know he had. He turned back to the chart, tapped the phantom billing code with his pen, that expensive pen that had just signed off on something fraudulent, and made a decision that Ashley could see crystallize behind his eyes like ice forming on glass. "I appreciate your diligence," he said, and the tone suggested he appreciated nothing at all. "These things happen. Clerical errors. I'll have the billing department sort it out." But he wouldn't. Ashley understood that immediately. He understood it too. Because understanding meant the same thing to both of them, she'd seen the pattern. She'd recognized the inconsistency. She'd asked the question that someone actually looking at the numbers might ask, and that made her a threat to whatever operation he was running, whatever arrangement he had with whoever was billing the hospital for supplies that never arrived, procedures that were documented but not performed, kickback arrangements that probably funded the lake house or the Rolex or the suit that cost more than her monthly rent. She'd seen the problem, and the problem was her. She returned to room 304 and tried to lose herself in the work of caring for someone whose mind had already lost itself. She checked the for insertion site, no redness, no swelling, good placement from the first try. She'd always been good with difficult venous access. Steady hands. Steady nerves. Those qualities had served her in one life and seemed to be defining her in another. The flashback came without warning, the way they always did. One moment she was checking the saline drip rate at Oak Creek Memorial, and the next moment she was in Ramadi again, 2008, Route Fran in the Jolan district, the kind of street that looked quiet until it was too late. Her hands were different then, dirtier, younger, unmarked by the kind of time that passes when you're erased from every database that matters. Her rank had been different too. Senior Chief Petty Officer. The call sign was Reaper. The mission was classified in a way that meant it would stay classified, which meant the people who got hurt there would never be officially mentioned, which meant she would never be officially mentioned either. The Marine in room 304 had been a major then. Not a general. Just a major, and they were moving through the streets clearing houses, and he'd been beside her when the round came through the window. Not aimed at him. Just random fire, the kind that kills through bad luck instead of bad aim. The kind that shatters bone and opens bodies and makes you understand that training and rank and experience all mean nothing when velocity meets tissue. She'd carried him. That's what you did. You carried them. 247 pounds of wounded Marine officer, and she'd carried him through the streets, back toward the FOB, while the Black Hawk was still minutes out. Her team was covering her. She was covering him. That's how it worked. That's how they all stayed alive. Except something had changed when the mission was done, when it was declared classified, when someone decided that certain operations couldn't be acknowledged and therefore the people involved in those operations couldn't be acknowledged either. She disappeared first. Senior Chief Petty Officer Ashley Cooper didn't exist anymore after that. She existed in photographs that were burned, in records that were sealed, in testimonies that were buried. The only proof she'd ever been a Marine at all was the unit patch sewn into the lining of her jacket, the skull and crossbones of an organization that didn't appear in official records, the kind of patch that would be evidence, if anyone looked. The kind of evidence she'd hidden so carefully that she sometimes forgot it was there. And then somehow, improbably, impossible, the man she'd carried through Ramadi had ended up in a bed at Oak Creek Memorial in Savannah, South Carolina, 3,000 miles from the place where they'd almost died together. His record said he was a Marine general now. Promoted. Honored. Acknowledged. While she remained invisible, working shifts in oversized scrubs, catching fraud schemes she shouldn't have been educated enough to notice, making herself visible in a way that might have just cost her everything. She looked at his forearm again. A. Cooper. Not a full name. Just initials. Just her call sign reduced to letters. His eyes were still searching for something. She wondered if it was her he was looking for, or just the ghost of whoever he'd been before the shrapnel and the deployment and the decision to classify him into oblivion. "You're staring," one of the other nurses said. Catherine, young, probably still believed that the world made sense. "He's been like that since he got here. Just stares. Sometimes he seems like he almost recognizes something, but then it's gone." Ashley nodded and stepped away from the bed, away from the empty searching eyes, away from the evidence that some bonds survive everything except being officially declared to have never existed at all. She went back to her documentation and tried to become invisible again. But the afternoon light had shifted, and Hargrove was still reviewing charts, and now when he looked at her, something had changed in the way he was looking. He saw her now. And that was the problem. He saw her now. And that was the problem. Dr. Hargrove stood at the nurse's station the next morning at 6:45, loud enough for the night shift to hear as they clocked out. He slapped a $20 bill on the counter beside the sign-in sheet, the sound sharp as a whip crack against laminate. "I'm starting a pool," he announced, scanning the faces around him. "This one," he jerked his thumb toward Ashley, who was 3 stations down, methodically stocking the medication cart, "doesn't last the week. Who wants in?" 2 residents laughed nervously. A medical student's eyes darted between Hargrove and Ashley, uncertain whether this was permitted, whether it was funny, whether it mattered. The attending radiologist made a noncommittal sound and walked past. Nobody took the bet. But everyone heard it. That was the point. Ashley continued stocking. 1 measured breath. Shoulders level. She didn't acknowledge the words, didn't flinch at the volume or the public nature of the cruelty. Her hands moved with precision, vials of midazolam, syringes in their boxes, ampules of epinephrine arranged by dosage. Muscle memory from another life, where precision under pressure meant the difference between soldiers coming home and flag-draped coffins. She'd learned then that dignity was a muscle. "You exercised it or lost it." Hargrove watched her for 3 seconds, waiting for a reaction. When none came, he smiled, the smile of someone who understood that the real prize wasn't visible defeat. The real prize was the knowing. The watching. The certainty that she understood what was coming. That afternoon, the cafeteria. 3 p.m. The shift change gap when the ER was still busy but the morning surgeries were done, creating a strange pocket of relative quiet. Ashley carried her lunch tray toward a back table, the soup steaming in its white ceramic cup, the salad already starting to wilt in the recycled air. Hargrove was at a center table near the entrance, his tray barely touched, his phone in his hand. He didn't look up when she passed. He simply extended his foot into her path, not far, just enough. Just enough that her right shin caught the edge of the chair leg. The tray tipped. Physics. Gravity. Inevitability. Tomato soup cascaded across her scrubs, warm and red, carrot scattering across the linoleum floor like tiny orange accusations. The bowl clattered. The salad dish followed. The room went dead silent. 40 faces turned. Silverware stopped moving. A nurse from oncology, Martinez, 3 years at Oak Creek, had her fork halfway to her mouth. Hargrove didn't look up from his phone. "Clumsy, aren't we, invisible girl?" His voice was pleasant. Almost concerned. Almost tender. The soup dripped from Ashley's sleeve. She looked down at her scrubs, the name tag reading A. Cooper, RN, the fabric dark with tomato, bits of carrot clinging to the weave. Her hands were wet. One tear escaped before she could stop it, just one, traveling the precise geometry of her cheekbone before she wiped it away with the back of her wrist. She raised her eyes. Met his directly. "I've carried heavier things than your opinion, doctor." Her voice was steady. Quiet. The kind of quiet that made people lean in to hear it. She set down her tray, gathered her wet hair into its band, and walked out without looking back. The fluorescent lights hummed overhead like they always did. Nobody stopped her. Nobody offered napkins or sympathy. In hospitals, humiliation moves fast, spreads like infection. By evening shift, everyone at Oak Creek Memorial knew that Hargrove had knocked her lunch across the cafeteria and that she'd walked away crying. What they didn't know was that she'd sat in her car in a parking garage for 6 minutes with her eyes closed, hands finally shaking, breathing exercises from a decade ago when her unit briefed on interrogation resistance. What they didn't know was that the crying had taken her by surprise, not the tears themselves, but the fact that there had been only one. That her training had held. That somewhere inside her, the thing they'd tried to erase was still intact, still in control, still measuring her responses in microseconds. She changed into spare scrubs from her locker. The faded Marine Corps patch was still there, sewn into the jacket lining where nobody would see it, a remnant of a unit that had moved through Ramady streets at night, a symbol of a life that official records insisted never happened. She touched it once, then buttoned the jacket and returned to the floor. The campaign accelerated. By Thursday evening rounds, the bet had become cultural currency. Staff members watched her with the fascination of people observing a countdown. How long until she broke? Hargrove had given her a deadline, had quantified her endurance, and now everyone was unconsciously rooting for her failure. It was more entertaining that way. A woman in scrubs falling apart was a story worth telling. A woman in scrubs who absorbed punishment without cracking was something else. Something uncomfortable. During evening rounds 2 days later, Hargrove reviewed the general's chart, the wounded Marine from Ramady, now 7 weeks post-op, the man whose breathing tube had been removed, whose pupils tracked but whose mind still lived in a place none of them could reach. Hargrove made a note, then tossed the chart at Ashley's feet. Paper scattered across the tile floor like white confetti. "Pick that up, sweetheart. It's what you're good for." She knelt. Steady hands. The other residents and nurses averted their eyes, not from sympathy, but from social calculation. Protecting themselves by not witnessing. She gathered the pages with methodical care, reorganizing them by date, replacing the tabs in precise alignment, checking the label on the chart jacket. All of it took maybe 90 seconds. All of it was silence except for the soft whisper of paper sliding together. She stood and handed him the chart, perfectly ordered. "Forgettable works for me, doctor." He leaned against the door frame with that smirk, the one that said he understood something she didn't, that he had moves yet to deploy. "You know what your problem is? You think being quiet makes you strong. It just makes you forgettable. Invisible. And invisible things? People stop looking for them. People stop caring if they disappear." Ashley held his gaze. "Then that's perfect for me, sir." She turned back to the med cart, her movements precise, her breathing controlled, and Hargrove laughed, the sound of someone who believed he was winning. He had no idea that he was speaking to a woman who had been officially erased from every government database, whose name had been removed from military rosters, whose existence had been negotiated away in classified briefings. Invisible wasn't a threat to her. Invisible was the only home she had left. That night, Parked in the hospital garage at 9:52 p.m., Ashley sat with her hands on the steering wheel and let them shake. Just for 20 minutes. Just in the dark, where nobody could see. She opened the emergency kit in her glove compartment, old habit, and found the photograph she'd hidden there. Her unit. 12 operators, standing in front of a Humvee outside FOB Shank, taken the day before half of them came home in flag-draped boxes. She was third from the left, barely visible in the shadows of the formation, the way she'd trained to be. Senior Chief Petty Officer Ashley Cooper. Erased. Reassigned to a life of scrubs and invisibility and institutional humiliation. She stared at the photograph for exactly 3 minutes, then opened the door and returned to Oak Creek Memorial, because that's what invisible people did. They showed up. They did the work. They let themselves be overlooked, and they waited for the moment when being overlooked would become their greatest asset. On her midnight rounds, she checked the general's vitals as she did every 4 hours. Blood pressure 124/78. Heart rate 86. Respiratory rate 14. Everything normal. Everything stable. She'd been watching him for 7 weeks now, this man who'd carried her name into combat and back out again, who'd forgotten her completely but whose body remembered hers in the way a compass remembers north. She smoothed his blanket and moved to the next patient, unaware that by the end of this shift, the trajectory of every life in this hospital would change. The general's monitor would start its specific alarm, not the aggressive beeping of arrhythmia, but the steady, persistent tone of something worse. His blood pressure would begin to fall. His heart rate would climb. His breathing would shift from steady to labored, and by the time anyone in authority acknowledged the problem, it would almost be too late. But that moment was still hours away, hidden in the future like a mine buried in sand. For now, the hospital was quiet. The night shift hummed along. Dr. Hargrove had gone home. And Ashley Cooper, Senior Chief Petty Officer, sat in the break room and waited for the emergency that would force her to make a choice that would burn down everything Hargrove had built. She had no idea what was about to walk through those doors. Midnight found Ashley moving through Oak Creek Memorial like a ghost in scrubs, vital sheets tucked under one arm, the fluorescent lights casting everything in that sickly pale wash that made the living look half dead. Room 304 sat at the far end of the corridor, where the monitors sang their digital lullaby to patients the hospital had mostly written off. The Marine General lay still as stone, his scarred forearms resting on bleached sheets, his eyes closed but never quite at peace. Even in sleep, his jaw worked like he was grinding something down. She'd checked on him 3 times since her shift started at 11. Routine. Just another patient, just another name on the board. Except the tattoo on his left forearm had her call signing to cross it in letters that had faded from black to something closer to ash over the years, and that detail lived in a part of her chest she thought she'd sealed off in Ramadi. The monitor showed what she'd been watching for, what her instincts had been whispering about since she arrived. His blood pressure was sliding. Not crashing. Sliding. Subtle. The kind of descent that takes experience to catch because it doesn't announce itself with alarms, it just drifts. 128/74 at 10:40. 118/68 at 11:15. 104/56 now. The heart rate climbing to compensate, trying to force blood through a system that was losing something critical it needed. She leaned closer. The jugular veins in his neck stood out like cords, distended and taut, pulsing with the frantic effort of a heart pushing against resistance. Tamponade. She knew that looked like she knew the sound of her own breathing. Blood accumulating in the pericardium, the sac around the heart, compressing the chambers, stealing the space they needed to fill. Every beat fighting gravity and pressure. Every beat losing the war. Ashley's hand moved to the call button without conscious thought. Muscle memory. Years of protocols worn into the deep places where instinct lived. She pressed it once, held it, counted the seconds until someone answered. Room 304. Need the on-call physician. Now. What's the presentation? The voice of the night charge nurse, Dolores, crackling through the speaker. Dolores had been here 15 years and missed nothing. BP trending down. Severe. Jugular venous distension. Heart rate compensatory. Could be tamponade. 3 seconds of silence. Then, calling Dr. Hargrove. Of course they were. Hargrove was always the on-call. Hargrove was always the one who answered at midnight because Hargrove lived 15 minutes from the hospital in that lake house that everyone whispered had been purchased with money that didn't come from his salary. Hargrove, whose eyes held something like hunger whenever a complex case walked through the doors, not the hunger to help, but something colder. The hunger of a man who knew suffering was currency if you knew how to monetize it. She stood at the bedside, watching the general's chest rise and fall, too shallow now, the work of breathing visible in the way his ribs moved. His eyes remained closed. No recognition. No memory of the woman standing 5 feet away. That should have made it easier. It didn't. The minutes stretched. She adjusted the oxygen, checked the fall line, noted the time. Every second, his pressure dropped another point. 102/48. 98/42. The body beginning its shutdown sequence, preparing for the end that Hargrove would arrive to witness. She heard the elevator doors open down the corridor. Boots on tile. Hargrove moved like he owned the hallway, a man who had never once considered that the ground might not be solid beneath his feet. He appeared in the doorway wearing a look of practiced concern, the kind he'd perfected for families and billing committees. "Show me," he said. Not a request. Not a question. An order. Ashley stepped back. She'd learned that much. Give the doctor space. Be useful, be quiet, be invisible. Hargrove approached the bedside, reached for the chart, scanned it with the speed of a man reading an insurance form rather than a medical history. He looked at the monitor for perhaps 5 seconds. He put his stethoscope to the general's chest for another 25. His hand found the carotid artery, took the pulse. His eyes moved to the jugular veins, the distension that screamed its diagnosis in a language medicine had spoken for 300 years. He straightened. Removed the stethoscope. Turned to face Ashley with his hands in his pockets, a gesture so casual, so dismissive, that it landed harder than any word. "He's too unstable for intervention," Hargrove said. His voice carried that particular tone, the one that sounded sad because sadness was credible, because sadness made him seem like a man who cared about outcomes rather than liability. Multiple comorbidities. The traumatic brain injury. Previous cardiac events in his history. We'd be performing a high-risk procedure on a patient with minimal viable outcomes. Ashley's jaw tightened. She felt it happen, felt the muscle clench down like a fist. "We need to call the cardiac surgeon," she said. Quiet. Level. Every word placed with precision. "The cardiac surgeon sleeps," Hargrove replied. Still that tone. "And even if we woke him, what would be the point? A pericardiocentesis on an unstable septuagenarian with advanced TBI? We'd be torturing him in the name of prolonging the inevitable." The words hung in the air like blood in water. The general's blood pressure hit 86/38. The heart rate climbed to 142. Climbing. Climbing. The body screaming for pressure it couldn't find. Commander Martinez arrived then, the general's daughter who'd been sleeping in the waiting room chair for 6 days, who'd held his hand every single morning even though he'd never once opened his eyes and recognized her face. She took in the scene, Hargrove standing with his hands in his pockets, Ashley frozen at the bedside, the monitors singing their falling song. "What's happening?" Martinez moved to her father's side. "What's wrong with him?" "His heart is showing signs of stress," Hargrove said. "Technically true. Also a lie. We're monitoring him closely." "You're not doing anything." "We're doing the kindest thing we can do." Hargrove's voice descended into that practiced gentleness. Sometimes in cases like this, the most compassionate approach is to make the patient comfortable. Aggressive interventions often cause more suffering than they prevent. Commander Martinez looked at her father's face, at the machines, at Hargrove. "How much time?" "Hours." Maybe less. The words landed like weight. Ashley watched the daughter's hand start to shake, watched the decision crystallize on her face, the decision to accept what she was being told by a man in a white coat who had just decided her father wasn't worth saving. That was when the door opened again. 2 more physicians entered, both men in their 60s with the bearing of men who'd been protected their entire careers. They moved with Hargrove's confidence, the confidence of men who'd never been questioned, never been wrong in any way that mattered. One of them reviewed the chart. The other listened to the general's heart. They exchanged a glance, that particular glance that Ashley recognized, that she'd seen in briefing rooms and trauma bays, the glance that meant they were calculating liability. "I agree with Dr. Hargrove," the older one said. "The risk-benefit analysis here is problematic. At his age, with his history. The risk is him dying right now," Ashley said. Every head turned toward her. The room seemed to compress, the air pressure changing the way it changed before a thunderstorm. "That's not your assessment to make," Hargrove said. His voice had lost its gentleness. The hunter showing its teeth. "No assessment needed. Look at his JVD. Look at his pressure gradient. This is textbook. There's maybe 5 minutes before we lose diastolic function entirely." "You're a nurse," one of the other doctors said. "Not cruel. Just clarifying the hierarchy." "I'm aware," Ashley replied. The general's heart monitor jumped. 148. 152. The body accelerating toward collapse, the chambers pumping against mounting resistance, every beat a battle it was losing. Hargrove moved to the door. The other doctors followed him. They stood in the hallway with the door half open, a distance that said they'd already left, that the outcome was already decided, that this room belonged to whatever came next and they'd made their choice about what that would be. Ashley stood at the bedside, watching the man with her call sign tattooed across his forearm, watching the pressure numbers falling like stones down a well. 120/40. 88/35. The numbers that meant minutes. Maybe less. But that wasn't the worst part. The worst part was the clarity. The sudden, terrifying clarity of understanding exactly what Hargrove had done. The general had arrived 3 weeks ago asking questions about billing, questions about procedures that hadn't been performed, devices that hadn't been implanted, charges that didn't match diagnoses. Before the TBI could silence him, the general had made calls. Called his daughter. Called his old commanders. Created a problem that was still alive in his medical record, still a potential witness to whatever Hargrove was building in the dark corners of Oak Creek Memorial. One patient dying quietly in room 304, no family present at the moment, no witnesses to how the afternoon progressed, no surviving testimony to billing irregularities or suspicious procedures. Just a man too old, too damaged, too far gone to save. Just a choice made in 30 seconds. Commander Martinez stood in the doorway, her phone already in her hand, already calling someone, already beginning the ritual of saying goodbye to a father who hadn't said hello in 3 weeks. Behind her, Hargrove watched from the hallway with the calm of a man who'd never once considered that his choices had consequences. Ashley's hands rested on the rail of the hospital bed, steady as the ground beneath Ramadi, steady as they'd been when she dragged this same man through streets where rounds pinged off concrete and mortars painted the sky. Her breathing was even. Her pulse was controlled. Her mind was running through options the way it had been trained to run through options. She looked at the monitor. 116/32. The numbers falling. The clock ticking. The choice crystallizing in the space between one heartbeat and the next. Some orders echoed louder than others. Some choices burned hotter than silence ever could. Ashley's hand reached for room 304's door handle at 2:33 p.m. She could feel Hargrove's eyes on her back before she even turned the lock. The sound it made, that small decisive click, might as well have been a rifle bolt chambering around. She didn't hesitate. Didn't check over her shoulder for permission. Just turned the lock and stepped inside, closing the door behind her with the kind of calm that comes from having already survived the worst. Hargrove's face went purple. His palm hit the glass window hard enough that nurses 3 stations away looked up. "Open that door right now." His voice carried the shrill pitch of a man watching his leverage dissolve. He pounded again, veins bulging at his temples. "I'm ordering you to open this door. You have no medical license. You have no authority." His fist came down a third time, and Ashley heard the muffled crack of his wedding ring against the reinforced glass. She didn't look at him. She was already pulling on sterile gloves, the latex snapping against her wrists with the precision of someone who had dressed for surgery in convoy trucks under mortar fire. The ultrasound machine hummed to life beside the general's bed. His blood pressure was 65/42. His oxygen sat at 68%. His heart was drowning in its own pericardial sac, and every beat was becoming harder than the last. "Commander Martinez." Ashley's voice was steady as surgical steel. "Call the charge nurse. Tell her to document everything in the next 5 minutes. Timestamp it. I need witnesses." Martinez moved without question. There was something in her voice, not a request. Not a plea. An order from someone who had given orders before. The resident grabbed the wall phone, his fingers shaking as he dialed. Ashley positioned the ultrasound probe against the general's sternum, her hands moving like they did in Ramadi, like they did in field hospitals that didn't exist on any map. Like they did when velocity and pressure and the mathematics of survival left no room for hesitation. The screen lit up with ultrasound gel and the general's anatomy, and there it was. The pericardial window. Dark fluid surrounding his heart like a fist slowly closing. Massive effusion. The heart struggling against compression with each weakening beat. She drew up lidocaine from the crash cart. 10 milliliters. Her thumb found the injection site at the subxiphoid space, that vulnerable triangle below the sternum where thousands of years of military medicine had learned to find the exact angle of entry. She infiltrated the skin, working methodically while Hargrove continued his assault on the glass window behind her. His shouting had brought a crowd now, nurses, residents, security officers uncertain of protocol. The next words out of his mouth changed everything. "I will have you arrested." Hargrove's voice cracked like breaking ice. "I will destroy you. You're finished." "Finished?" Ashley didn't respond. She was already advancing the 18-gauge needle under ultrasound guidance, steady pressure, watching the screen as the needle tip drifted closer to the pericardial sac. The general's eyes were open now, watching her, and she could see something shifting behind his confusion, recognition maybe, or just the clarity that comes when someone fights for you instead of abandoning you. The needle entered the sac. Flash of blood on the catheter tip. Dark and immediate. She advanced the guide wire, removed the needle, threaded the drainage catheter with movements that had become muscle memory before she was legally allowed to vote. Connect the syringe. Begin aspiration. The first pull brought blood, 60 milliliters. Her second draw, 100. Her third, 150. Dark fluid filling the chamber like the room was holding its breath. The heart monitor's alarms began to silence. One by one. The high-pitched shriek of low blood pressure faded. The rapid beeping of tachycardia mellowed. The general's chest rose and fell with easier rhythm. His blood pressure climbed, 75 systolic. 85, 95. His heart rate dropped from 128 to 110 to 95 to 80. The monitor transitioned from the frantic language of dying to the steady dialogue of survival. The general's eyes opened wider. Clearer than they'd been in 3 weeks. He looked directly at Ashley and his mouth moved, though no sound came out. Security unlocked the door. Hargrove pushed through first, his face the color of raw meat, and Ashley stepped back with the catheter secured and draining properly. She pulled off her gloves methodically while he stood there gasping, while Martinez documented timestamps, while the gathered nurses and residents stared at what had just happened in a locked room. "You just ended your career," Hargrove said. But his voice had changed. It wasn't a threat anymore. It was a prediction. A surrender. He left without another word, and Ashley realized, with a clarity that felt like ice water, that he already knew. He'd already made the call. This man didn't threaten. He executed. 2 hours later, Ashley sat in the administrative office on the 3rd floor while Hargrove stood beside the chief medical officer and a hospital attorney whose hands never left the folder in front of her. The fluorescent lights overhead hummed their tireless electric song. The attorney's voice was flat as a monitored flat line. You performed an invasive surgical procedure without physician supervision and without licensure to practice medicine. We have no choice but to terminate your employment effective immediately. Security will escort you to collect personal belongings. Ashley didn't argue. She couldn't. Every sentence from her mouth was a liability. Every word could be used to verify that she had knowledge, training, capability. She stood, nodded once, and followed the security officer down corridors that suddenly felt longer than they had that morning. The walk to her locker took 40 seconds. She'd measured it once at 0300 hours when she couldn't sleep, when the nightmares about Ramadi grew too loud. She packed the cardboard box security provided. The cracked mug that said "World's Okayest Nurse" in fading letters. The succulent she'd forgotten to water for 3 weeks, leaves brown and curling inward like a fist. The photograph, her SEAL team, Charlie platoon, 3 tours before Ramadi, before 3 came home in flags, before the rest of them were ordered to disappear, scattered across the country with new names and new lives and the kind of silence that felt like drowning. The faded unit patch sewn inside her jacket lining was getting damp. Rain hammered the parking lot outside like artillery fire. She stood at the bus stop with the cardboard box pressed against her chest, watching headlights blur through water on the windshield, wondering if invisibility had finally crushed her or if she had crushed herself by forgetting that she was anything more than what people saw. A Marine general who bore her call sign on his forearm lay in room 304 with clear eyes and steady vitals. But that didn't matter now. She was erased. Again. The bus pulled up. Its doors opened like a mouth. Ashley stepped on and paid her fare without looking back at the hospital lights dissolving into rain. The rain hammered the parking lot like judgment, and Ashley stood at the bus stop with a cardboard box that contained everything the hospital was willing to let her keep. Cracked mug from the break room. Dying succulent with leaves the color of old bruises. Photograph of her Ramadi team, 17 faces smiling in desert sunlight, 8 of them shipped home in flag-draped cases. She didn't look at the photo. Couldn't. Not yet. Her scrubs were damp, clinging to her ribs like a second skin, the name badge already pried from her collar by some administrator with steady hands and no eye contact. They'd walked her out at 5:56 p.m. She'd checked the clock on the corridor wall, a habit from a life where seconds meant survival, and watched the minute hand tick forward like it was counting her erasure. The bus pulled up and she paid the driver without looking back at Oak Creek Memorial's lights dissolving into rain. She found a seat by the window and watched Savannah blur past, magnolia trees and Spanish moss and streetlights reflecting off wet asphalt. The other passengers didn't know she'd just been fired for saving a life. They saw a tired nurse in damp scrubs, nothing remarkable. That invisibility used to be her armor. Tonight it felt like a coffin. She pressed her forehead against the cold window and felt the faded unit patch sewn inside her jacket lining, the only thing she had left that proved she'd ever been anyone at all. SEAL Team 3, Charlie Platoon. Senior Chief Petty Officer Ashley Cooper. A classification level so high that her official records were archived in a Pentagon basement that didn't exist on any organizational chart, locked away in a vault beneath the building that housed every operation the United States government refused to acknowledge. She'd carried the general through Ramadi streets while rounds pinged off concrete. She'd held pressure on his abdomen while his blood painted her hands. She'd done everything right for a man whose memory of her had been erased by shrapnel, and the moment she saved his life a second time, the system she'd trusted to protect her classified identity turned around and destroyed her instead. Dr. Hargrove didn't waste time grieving his loss of control. The moment the ER doors closed behind Ashley's departure, he was on his phone in his private office, door locked, calling in every favor owed to him across the state. Board members who'd approved his equipment contracts answered his calls. Orthopedic suppliers who'd filled his lake house with lake house money listened to his version of events. His voice was smooth as a blade through water. He wasn't desperate yet, wasn't panicking. He was strategic. Competent. A rogue nurse, he explained to each listener. Practiced medicine without a license. Performed an invasive procedure on a patient without physician authorization. Compromised the hospital's liability exposure. We're handling it internally, but I wanted you to understand the situation before any regulatory inquiries come through. He let that threat hang in the air like smoke. The lake house people understood threat language. They'd been speaking it for years. By 9:41 p.m., Hargrove had contacted an outside investigator, a firm that specialized in discrediting healthcare professionals, the kind of operation that existed in the margins of the medical legal system where ethics had a flexible definition. He provided them with every detail: Ashley's name, her shift schedule, her sudden appearance at Oak Creek Memorial, her singular instance of intervention in the general's care. "I need documentation," Hargrove said, his voice carrying the confidence of a man who'd never lost a battle fought in institutions. "Formal statement about her acting as an unlicensed practitioner. Something I can present to the board." The investigator took notes. 48 hours, he promised. "We'll have enough to recommend termination." That same night, at 11:15 p.m., Hargrove's team reached out to fabricated previous employers, hospitals that appeared legitimate on the surface but were actually aliases, addresses that existed in databases but not in reality. References that would destroy her. They were building a paper trail of instability, of misconduct, of a nurse whose history didn't hold up under scrutiny. Every piece of documentation was a lie, but lies have a way of becoming true once they're typed into enough official forms. By morning, when the hospital board convened for an emergency session, they had a narrative: Ashley Cooper was a problem. A liability. A threat to patient safety who'd acted outside her scope of practice and fabricated her credentials. The board meeting lasted 17 minutes. That was all the time they needed. The chief medical officer, who'd never spoken a single word to Ashley in her months at Oak Creek Memorial, voted to terminate her employment effective immediately for gross misconduct and practicing medicine without a license. No hearing. No opportunity for context. No mention of the fact that she'd saved the general's life while they were all somewhere else, probably eating dinner, probably thinking about their evening. The board voted unanimously. It took 8 seconds of silence before the motion passed. One of them, an older woman who looked vaguely uncomfortable, asked if they should at least allow Ashley to respond to the charges. "Let her legal team handle it," the chief medical officer said, already closing his notebook. "We've got documentation. We're protected." Ashley didn't know any of this yet. She was standing at the bus stop when the rain started, real rain, not the drizzle that had followed her out of the hospital but sheets of water that hammered the shelter's metal roof like 1,000 fingers demanding entry. The bus wasn't due for another 20 minutes. She stood with her cardboard box clutched to her chest like it was all she had, because it was. The photo inside was getting damp at the edges. She could feel it through the cardboard, the rain seeping in because nothing was ever truly sealed. Things got in. Water got in. Loss got in. The bus shelter was empty except for an old man reading a newspaper, and even he got up and left when the rain intensified, muttering about needing a real roof. Ashley didn't move. She'd stood in worse weather. She'd stood in torrents that came sideways out of the Arabian Sea while the ocean tried to kill her. She'd stood still while shells landed close enough that she could taste the copper in the air. Rain was nothing. Nothing was the problem. Rain had company and sound and weight. Invisibility had nothing. The man from the bus shelter left, and then there was only Ashley and the cardboard box and the rain that would not stop, would not pause, would not give her a single moment of mercy. She stood there for 32 minutes, she counted them, another habit from a previous life, and wondered if this was how it ended. Not with a bang, not with classified operations and medals and acknowledgement of what she'd done in the dark. Just a nurse in wet scrubs at a bus stop in Savannah, holding everything she owned in a box that was slowly dissolving, wondering if invisibility had finally crushed her completely. She'd been erased once by the Pentagon, ordered to disappear for operational security, separated from her identity and her service record and the rank she'd earned through sweat and blood and decisions that would follow her into her grave. They'd called it necessary. They'd called it patriotic. And for 18 years she'd accepted it, worn invisibility like a uniform, made herself small enough that the world didn't even know she existed. This erasure felt different. This was personal. This was a man with a lake house using the same system that had already taken everything from her, weaponizing it, turning institutional power into a knife with her name on it. She couldn't defend herself. She couldn't explain that she'd been ordered to disappear after the operation in Ramadi was classified beyond classification, that Senior Chief Petty Officer Ashley Cooper had been erased from every database to protect an operation the government refused to acknowledge. She couldn't tell them that the man in room 304 had her tattooed on his forearm in letters that said Reaper, that she'd carried him through streets where the bullets never stopped coming, that saving his life hadn't been a choice, it was a debt written in blood and sand and 5 years of pretending to be nobody. All she had was a cardboard box and a bus stop and the slow creeping certainty that some erasures don't end. They just repeat, each time a little deeper, until there's nothing left but the ghost of a person who used to know her own name. The bus arrived at 6:19 p.m. She boarded without looking back. The doors closed with a hiss of air escaping, and Oak Creek Memorial Hospital receded into the rain-soaked darkness like a ship she was finally being allowed to abandon. She didn't know yet that Hargrove's network was already activating, that federal investigators were being contacted, that the truth about what happened in that room was being buried under layers of paperwork and institutional cowardice. She didn't know that her return to the hospital the next morning, walking past room 30 for one final time, badge in hand, ready to return it to the administrator's desk, would trigger a chain of events that would bring the truth crashing down like a building imploding from the foundation up. She didn't know that the general's eyes were already beginning to focus, that memory was already beginning to creep back in, that the moment he remembered her face was going to change everything. All she knew was that the cardboard box was getting heavier and the rain showed no signs of stopping, and she was standing at the absolute bottom of another life, wondering if she had the strength to climb out one more time. But that wasn't the worst part. The worst part was knowing that even if she did climb out, even if she survived this and walked back into the light, there would always be another Hargrove waiting. Another system willing to erase her? Another hospital where being invisible wasn't a choice but a sentence, and she'd spent so many years learning to accept the sentence that she no longer knew who she was without it. The bus drove deeper into Savannah, and Ashley Cooper, Senior Chief Petty Officer, Reaper, the woman with nothing left to lose, sat in the back with a cardboard box and waited for the next impossible thing to begin. She didn't have to wait long. We appreciate every one of you watching. Please hit like if you're enjoying this, subscribe if you want more stories like it, and leave a comment telling us where you're tuning in from.